For joining us, the governor's in the House, Tate Reeves. Good morning, sir. How are you?
Well, I am doing fantastic today, Paul. Hope you're doing well. It's any day that starts with temperatures in the upper 50s, lower 60s, and the highs aren't going to get above 80 is a great day. It's almost fall weather out there.
I feel it from you. You get a little bit of a lift when that temperature changes in Mississippi. It just adds a little bit more of a step in our step.
Well, we love fall weather. We love football weather, and I think that we're going to have a little bit over the next few days, and hopefully it sticks with us. But the weather in Mississippi, it always changes, so it'll probably be back to summertime early next week.
Well, let's get into COVID first of all, and it looks like when you start looking at some of the numbers that it's going down a little bit. But what do you see and what do you hear from the health department?
Well, what we're seeing is really what we would have anticipated. As you've heard me say many times before, we watched the Delta variant in the country of Israel. We watched it in the United Kingdom. And what we saw there is that with the Delta variant, it's highly contagious, and we saw significant upticks in the number of cases in those countries, which is what we saw in Mississippi. It happened very, very quickly there and here. And we also saw in those two countries very, very quick declines in terms of number of cases as well once the numbers rolled over. We are actually experiencing that here in Mississippi as well. We reached a peak of 3,600 cases per day over a 7-day average. On Monday, we had 1,667 cases. Over the weekend, a 3-day weekend, or for reporting purposes, a 3-day reporting period, we had less than 3,000 cases. And so our total number of cases today are on a 7-day average in the 1,500 range, which puts us down almost 60% from the peak. And the number of cases are important to start the conversation, but I've been clear throughout the last 18 months that while cases are important, our goal is not to eliminate or eradicate the virus, because we don't think that's a realistic goal. Our goal is to make sure that every single Mississippian that can get better with quality care receives that quality care, and that's why we talk so much about hospitalizations. And we reached a peak of 1,667 Mississippians in hospitals earlier in the summer. As of September 20th, that number was down to 812 patients in our hospital, down 52% from the peak. You look at the number of patients in ICU beds. We peaked earlier in the summer at about 486 patients. We are now down to 305 patients in ICU beds here in Mississippi, down about 38%. Mm-hmm. And then obviously the number of patients on ventilators, getting on a ventilator is something that leads to mostly very poor outcomes. We had 354 patients on ventilators at our peak, and now we're down to 221, again, down about 40%. Yeah. So, again, the numbers have rolled over. We're in a much better spot today than we were a month and a half ago, but we still need to be diligent.
When you look at the surrounding states, Arkansas, Louisiana, and Tennessee, we're more than – why do you think it is? Their restrictions are not that much more than ours as far as any executive orders or any edicts from the governor's office as far as mandates are concerned.
Well, actually, if you look at the curves in the state of Missouri, the state of Arkansas, the state of Louisiana, and then look at the curve in Mississippi, the curves look almost identical.
Do they?
Regardless of restrictions, the curves look almost identical.
Are they also peaking? You're saying that?
Their curves look identical to ours, but they were a few weeks before ours. And so this Delta variant really started in that lower Midwest in the Missouri area, came into Arkansas, Louisiana, Mississippi. Now it is moving up towards the Northeast. If you look at the states that have the highest number of cases per 100,000 residents, it's really the northeast part of Tennessee, it's West Virginia, it's the southwest part of Virginia is beginning to get very red on the charts and maps of the United States, and this is not should not be surprising to people. This is what happened last year as well, Paul. As people move indoors, this virus tends to spread more rapidly. And with the Delta variant, it spreads even more rapidly than it did a year ago because it is so highly contagious.
You would think that the study about outdoors is not as bad plays out now, because with the ball games in the last few weeks, you would think it would just be out of control. I'm playing a little devilish here, because when you were talking, I thought, when you're talking about the curves and everything, have you checked what they are in Peru? What exactly did Tapper want the state of Mississippi to do?
I have no idea. Look, here's the reality. When talking to these national political reporters, they want to convince the American people whatever the president says is actually accurate. And the reality is the president, in trying to issue vaccine mandates, knows that he doesn't have the authority to do so. He doesn't have the legal authority to issue vaccine mandates, but he wanted to change the conversation. I heard you talking earlier this morning about the illegal immigration that is occurring across our southern border. The president wants to talk about anything but illegal immigration across our southern border, anything but Afghanistan, and the many other absolute travesties that are occurring in our country and across the world because of his lack of leadership.
Have you heard any information about any being dropped off in the state of Mississippi as far as Haitians are concerned?
None at this time. Yeah. But again, the administration doesn't do a real good job of communicating.
I was going to say, you wouldn't be notified anyway.
That's exactly right.
We did have some at one point several months ago in, I think, Natchez.
There was a small group that occurred. But look, Paul, the reality is, whether the administration drops off illegal immigrants or not, 1.3 million people have come across our southern border since this president has been president, and that is about 40% of the population of Mississippi. That is greater than the population of at least 10 states in the U.S. has flooded across the southern border illegally in just the last 9 months. It's a travesty, and it's a humanitarian disaster that this administration wants to ignore.
If you look at the people that he's put in these positions of power to make these critical decisions, you got to be worried about it. Any private sector guy would fire most of these people. When you look at Mayorkas, and he was asked this question, I think, yesterday, and just they are living in a reality world that doesn't exist.
If you annualize these figures, 8 to 1,100 known gotaways, which would equate somewhere over 300,000 known gotaways for the year, and a couple 100,000 people per month. We'll be up to about 2.1 million apprehensions. Add the getaways, 300,000 to 400,000. We're up to 2.5 million people. You have repeatedly stated that our borders are not open, that they're closed. Do you honestly believe that our borders are closed?
Senator, I do.
How do you answer that?
2.5 million.
2.5 million.
2.5 million in 1 year.
Yeah.
And he wants to argue that our borders are closed. Look, they're not based in reality.
This kind of filters over to, if that happens and they are ingrained into our system and they stay here, then they most likely will have to go on Medicaid too. Or they would qualify, I guess, one way or the other. I'm not sure. Depends on what the citizenship looks like, and who knows where that's going to go in the future. But let's switch over and talk about the Medicaid expansion. I got this story yesterday. Democrats in the U.S. Congress are considering a way to offer health care insurance for Mississippians, low-income Mississippians who've been denied coverage because of our laws. The proposal would provide health care coverage to people who are below the federal poverty level, including Mississippi, that have not expanded Medicaid under the Affordable Care Act. They say it would be between 200,000 and 300,000 people. I think the state economist Miller was talking about this also. We'll ask you about that and where it stands as well. And I want to get this out of the way when we come back. Your official stance or report on the rumors out there about a special session. And remember, FDIC, the governor in the House. And let's open up with the latest that we have. House and Senate both, from what I hear, have their bills either ready or near ready. And I know you've had some communication, so as governor, what can you say about the update on the special session?
Well, as I've said repeatedly, Paul, when the House and the Senate and the legislature reaches a consensus, I am willing to look at it and then call a special session. We're not quite there yet. They are, a bill becoming law is a complicated process, and typically you have a committee hearings and committee discussion, and then it goes through one chamber. And in essence, what we're doing now, Paul, is all of these things are occurring, but it's not costing the taxpayers any money. And so I think most of the individual legislators are aware of some of the conversations that have been ongoing, and they're providing feedback to the leadership. And so we're certainly making progress, but we're not at a point where a special session is immediate.
So there seems to be some snafu or some differences that are between the House and Senate that you want rectified before you call a special session.
Well, I think that there's still conversations to make sure that there's an adequate number of members that are comfortable with the consensus that is being formed.
Anything that's formed. In other words, are there some that just will not vote for it, period, as far as medical marijuana?
Oh, I'm sure there'll be a large contingent within both the House and the Senate that will not vote for this particular bill, no matter what it says. There are some that are just adamantly opposed to it, and I understand that position. When
was the last conversation you had as far as how far apart they are?
Well, I think our team has probably had a conversation within the last day or so. I mean, this is a pretty consistent thing where the team in the House and the Senate and in our office have been in communication. I haven't seen a bill itself, but that's certainly forthcoming, I'm sure.
When you look at the immediacy needed for a special session, is there a point now, if they can't get together, at what point, the next week, 2 weeks, 3 weeks, then you could say, look, we're only, 50, 60 days, right now about 90 days away, I guess, from the 2022. Just wait for the session.
Well, I'm sure there is a point at which we get there, but I think the voters went to the polls, voted for a medical marijuana program. They were very clear in their statements, and it was a fairly large majority voted to pass it. And so I think as soon as consensus is reached, the special session should strongly be considered.
What would you put in there beside this? Because we were talking about that adjustment made to, was it to Medicaid or to the reimbursements as far as hospitals? Or it was something that needed to be rectified.
Yeah, there is an issue on changing in pricing for providers of Medicaid services. There was chokehold language that was put into the Medicaid Technical Amendments Bill. There's a lot of providers and a lot of legislators that are very concerned about that and the ramifications for it. Many of them didn't know they were voting for it. And so there is some conversations around that. I don't have any intentions of adding that at this time, but should there become consensus amongst the leadership in the legislature, we could potentially do so. But again, that's not at the top of mind right now.
That wouldn't necessitate calling a special session.
If there was a consensus to fix it, perhaps we could. I am very much for fixing that language. I think we didn't have that language in the bill between 2018 and 2021, and during that time, through good conservative management by our Medicaid director, Drew and his team, we actually saw the total expenditures from the state go from $1.031 billion to under $900 million. We saw a 15% decline in annual expenditures. We saved $150 million a year in Medicaid because we had the flexibility to run it, and now the legislature has taken that away from us.
Would you put also, and we were talking yesterday with Sean Tyndall, would you put the COVID beneficiaries back in there as far as the first responders, if there happens to be one?
Well, Paul, what you have done this morning is you have identified the challenge with being governor and the challenge with calling a special session, because there's at least 100 different items that people would like the call to include. We want to focus on this issue that the voters voted on overwhelmingly, and the other items, certainly we can have discussions around those, but there's no intention at this time. That is an issue that is important. I certainly support our first responders and those who work so very hard to protect us and keep us safe. This has been a tumultuous year and a half for those who wear the uniform, and I will do anything I can to make them to show that we in Mississippi support our first responders, our policemen.
I think the people,
and our firemen.
I call these folks the castaways from Mississippi yesterday. I know they loved, the liberal media loves when they hear things like this. Mississippi State economist Corey Miller has said basically it would be a break even or better as far as expanding Medicaid. But the problem was he couldn't answer the questions about those variables that nobody can. Other states have done, he said 200 to 300,000 people. I think he said 228 to 233,000 between 2022 and 2027. But again, that's open. Other states have had that. Well, it was in Kentucky and several other states who've said, okay, here's how many people, if we expand, would be, and that sometimes it's doubled or tripled. So you have no idea how to control those costs. Your thoughts on that?
Well, you've made the exact right point, Paul, yet again, and that is the assumptions that are made in any analysis are really, really important. So let's talk about and again, I haven't studied the analysis that's done, and the reason I haven't studied it is because I don't believe the assumptions that were made to get to the final conclusion. And here's why. 228,000 is the number that is assumed would be added to the Medicaid rolls in this particular report, I am told. You don't have to go far. Let's just look at Louisiana, immediately to our west. Louisiana is 1.5 times the size of Mississippi in terms of population. Mm-hmm. Very similar demographics, very similar other issues, and so it's fair to look at Louisiana. It wouldn't be exact, but we should look at that. When Louisiana expanded Medicaid, they increased their rolls by some 600,000. So 1.5 times our population, but 3 times the number that is assumed in this particular report. Yeah. That one fact, for me, says throw that report out because the assumptions are not realistic.
Well, the other thing, too, to be responsible to the taxpayers of the state and also responsible for the people who are already on there, because the more you stretch that, the more of a risk the people who are on there below even that poverty line become at risk as far as the program is concerned. Once you explode it, they stay there, that number. What the federal government decides to do in the future by reducing it, we still got to pay for it.
Well, it's also the risk associated with all of the other programs that are funded by state government, because obviously even though we've seen significant savings in Medicaid because of proactive management by our division, we've saved $150 million a year compared to where we were 4 years ago. We still spend $900 million a year in state funds on the Medicaid program. That's a fairly large expenditure. Yeah. Paul, and one that we need to be aware of.
We don't have a lot of time here, but I want to ask you your overview of where the funds are that are coming in. Are you satisfied where they're getting out there to where they need to be as far as broadband and everything else?
Well, let's talk a little bit about state revenue because I think that's really important. In the fiscal year that ended June 30th, Mississippi collected over $1 billion more than was projected. Over $1 billion more. In the first 2 months of this fiscal year, that's July and August, we've collected over $150 million more than was originally projected, which puts us on pace to, again, this year collect about $900 million more than is spent in the state with state resources, which is one of the reasons that the best course of action that we can take in terms of eliminating the income tax is not by robbing from Peter to pay Paul, not by cutting your taxes on one side and then raising them somewhere else, but instead focus on taking that nearly $1 billion and giving it back to the taxpayers who actually sent it to the state government. When
you look at all of this, and the revenues have been incredible, especially through the pandemic, when you look at all of this, and you understand this is going to come up in the 2022 session as far as the personal income tax, have your views changed on that one? I'll ask you that when we come back in the final segment. Have your views changed on that one? Have those meetings are still going on? We're talking about that, and we'll cover those two things when we come back. Okay, we are back live with the governor in a short segment here, so let's get to this one. As far as the personal income tax, any meetings on that and anything going on, and your view on where we are now?
Yeah, the legislature's had numerous meetings. Both the chairman of the Senate Finance Committee, Senator Harkins, as well as Trey in the House have had joint meetings. Who's the chairman of the Ways and Means, have had joint meetings and had a lot of conversations surrounding it. We've got a lot of people on board that the best thing for the economic prosperity and the future of Mississippi is to eliminate the income tax. We're now talking about how we do it, and I think that's a good conversation, and it's incredibly important. I think it can really help move our economy forward, and it can allow taxpayers to keep more of their money, and I think that's a valid goal. As I mentioned earlier, we have collected approximately $1 billion more last year. The income tax brings in a little over twice that amount, so we could cut the income tax in half today and never cut one expenditure in state government. So my view is we should raise teacher pay. I've got a plan out there to raise teacher pay, and then the rest of the money that we've collected, we ought to give it back to the taxpayers.
I do always mention this because it's one of those new things that happen to coincide with this. If we are bringing in a new industry like medical marijuana, there's a heck of a lot of money attached to that. Is that one way that may help us reach that personal income tax reduction?
That's an additional revenue source that we don't currently collect. It's not unlike the lottery in that regard. And so any revenues that are collected through that particular revenue source, again, it could be utilized to offset any revenues that were collected at the income tax, and that's yet another piece. So we could probably reduce the income tax immediately by 60 to 65% without raising anybody's taxes, and still have the same amount of money in government that was spent last year. And Republicans should not be for growing the size of government, and I hope that our legislature is not.
I'm sure you've been privy to this. Are there some ways that they've come up, some creative ways to come up with that? And I know the Senate has to be pleased with it because the House is their package, but is there some creative ways to come up with it?
With the other one-third? Oh, absolutely. And the best way to do it, in my view, is to allow revenue growth, growing economy, to allow us to phase it out over time, a 5-year phase out of the final $400 or $500 million. We did a $500 million tax cut 5 years ago. The very same people who are against eliminating the income tax were against our $500 million tax cut 5 years ago. They said we would not have adequate resources, couldn't fund state government, and yet here we are 5 years later, a significantly growing economy that has produced over $1 billion more in revenue. And the fact is, and this has always been the case, the people know better how to spend their money than any governmental entity ever will.
Well, by the time you put that first stage of the income tax and the franchise tax and the inventory tax and all those cuts, and then you start looking at revenues at $1 billion plus, come on. How can you make an argument over that one? Let me, real quick, in the time allotted to us, and the governor's with me, we constantly have new expansions going on and some good news out there. Anything new to report as far as businesses are concerned?
Well, I'm extremely optimistic about Mississippi's future, Paul, because I am talking to CEOs both inside the state of Mississippi and outside the state of Mississippi that are looking to expand their businesses, and they're very, very interested in Mississippi right now. We've got to continue to invest in our workforce, because the reason we are attractive for all of these new entities that we've brought into the state is because of our workforce. And so you look at just DeSoto County alone, we've seen, since I've been governor, over $500 million in capital investments. You go to immediately to DeSoto County's east in Marshall County. Just since I've been governor, we've seen approximately $120 million in new capital investments in Marshall County alone. And so all told, we're closer to $2.5 billion in the last year and a half in terms of new capital invested in Mississippi, thousands and thousands and thousands of jobs being created. And we're seeing new opportunities every day. And quite frankly, we're making new announcements every day. Yeah. And it's the new announcements in smaller communities in rural areas across the state, 30 jobs here, 30 jobs there, 50 jobs here, 50 jobs there, that are going to make a difference in those communities, and I couldn't be more proud of them.
The CEO from coastal Mississippi, Milton Sequeira, suddenly resigned, and that was disheartening for a lot of people. Is there a power struggle going on there, or is that back to every man on his own, or what's going on there?
Yeah, Paul, I saw the news reports on that. I have not been privy to the conversations. I don't know exactly what caused that. What I do know is tourism is at an all-time high in Mississippi, bouncing off where we found ourselves years ago. And so you go to the Mississippi Gulf Coast and you cannot get a hotel room, whether it's Wednesday night or Sunday night. You cannot get a hotel room. Right. That tells me that tourism is doing exceptionally well on our Gulf Coast. Jay
Daniels, the new guy, was with me this week, and he says they're hitting on all cylinders.
It's
Everything
really
looks
going
pretty
well.
Darn good. It's always good having you, sir. Appreciate it very much.
Thanks, Paul.
Governor